Good morning. Today we'll be seeing about parts of your large intestine, that is cecum and appendix. First we'll be seeing cecum. So what is cecum? Cecum in Latin means it's a blind sac, or you can say blind end. So this will be seeing under following things. One is the parts, or you can say features of it. In that we'll be seeing where it is located. Then we'll be seeing the relations of it. Then rhesus, then at last how it looks in the interior part of it, then arterial supply, venous drainage, lymphatics, and the nerve supply. First thing, coming to the features, if you are dividing the anterior abdominal wall, or you can say abdomen, into 9 quadrants, at which quadrant we will be finding this cecum. So what is this quadrant? This is your right iliac fossa. So present in the right iliac fossa, related with the lateral half of the, what is this ligament? This is inguinal ligament. So related with this lateral half of the inguinal ligament and located in the right iliac fossa, we are having this cecum. Then what are the features apart from that? What is this? Cecum is present in the proximal part of the ascending colon. Opening at this junction, we have part of the small intestine, that is ileum. This is ascending colon. What are the features of this? If you see the height and the width of it, the height of the cecum is 6 centimeters and the width is 7.5 cm. So this is one of the organ in the body where the height is less than the width, or you can say width is greater than the height. So above, how it is? Above, it's in continuation with the ascending colon, and on the medial side, or you can say this is on the left side, it's having opening of ileum, and on the right or on the lateral part and inferiorly, it's having a convex wall. Then what is the other thing related with this region, with this organ, is appendix. So related with this cecum, we have 3 modifications of your longitudinal muscle, that is tinea coli. So what are they? Based on their position, you can divide that into 3 things: anterior, posterior, this will be lateral, and the medial. So this is anterior tinea coli, this will be posteromedial, and this will be posterolateral. This is posteromedial tinea coli. So all this tinea coli of this large intestine, they converge onto the base of the appendix. So that is one clinical feature when you are doing a surgery for appendicitis. How do you identify that? So this tinea coli will be converging near the base of the appendix. Then what are the relations of this? This is present in the right iliac fossa. So when it is distended anteriorly, it will be related with anterior abdominal wall. So relations, when it is, so anteriorly we will be seeing, when it is distended, it's related with anterior abdominal wall, and if it is relaxed, it will be related with the small intestine loops. Posteriorly, at this region, if we have the cecum, posterior to that we have some muscles, and apart from that few vessels. So what is that muscle? We have one is psoas muscle, and one more thing is iliacus. So these are the two muscles related with that, and three nerves. One is femoral nerve, one more thing is genitofemoral nerve, and last one is lateral cutaneous nerve of thigh. So these are all of the right side. So right psoas major, right iliacus, right femoral, right genitofemoral, lateral cutaneous nerve. All these are related to the caecum on the posterior part. Then one more thing, openings into this, there are two openings which are present in the posteromedial part of the caecum. So if you are seeing a transverse section of the caecum and you are dividing that into four quadrants, this is anterior, posterior, lateral and medial. So this quadrant will be posteromedial quadrant, this will be anteromedial, anterolateral, posterolateral. So in this quadrant it's related with two things, one is the ilium and one more thing is appendix. So ileocecal opening will be at the higher position than the appendicular opening. Then coming to the rhesus. So this is actually a intraperitoneal organ, but it doesn't have any mesentery. This is caecum. Above that, this will be your colon, caecum. So near this junction, where this colon and caecum, we have an opening called ileocecal. This point is ileocecal opening, and somewhat below that, we have one more thing, that is appendicular opening. So related with this, we have three rhesus. One rhesus is lying behind us, that I am showing with the dotted. So this will be calling it as retrocecal rhesus. Retro because it's behind the caecum. So in this, so anterior to this retrocecal rhesus, we will be having the caecum, and posterior to that we have the psoas major and iliacus muscle. So most commonly in this retrocecal rhesus, we will be finding appendix. Most common position of appendix is also retrocecal position. Then other rhesus related with this are in this region. One is above the ilium, one is below the ilium. So this you are calling it as superior ileocecal rhesus, and one more thing is inferior ileocecal rhesus. So related with this superior and inferior ileocecal rhesus, we are having few folds of the peritoneum, that you are calling it as anterior ileocecal fold and the posterior ileocecal fold. So this point is your superior ileocecal rhesus. So anterior related with that, we have a fold of peritoneum. This you are calling it as anterior ileocecal fold. In this ileocecal fold, we will be having a blood vessel supplying the caecum. So this is anterior caecal artery, which will be present in this anterior ileocecal fold. Same way related with this inferior ileocecal recess, we have one fold. So that is inferior ileocecal fold. But this ileocecal fold doesn't have any blood vessel, so that other name for that is bloodless fold of Treves. That is the inferior ileocecal fold is otherwise called bloodless fold of Treves. So that is about the recess. One recess is behind the cecum that you are calling retrocecal recess. Most commonly in that we will be finding the appendix. The most common position of appendix is retrocecal. Then two more recesses are related with this ileum, superior ileocecal recess and inferior ileocecal recess. So related with this superior we are having superior anterior ileocecal fold, and one more thing is here we have inferiorly. So this is superior ileocecal fold, not anterior. This is superior ileocecal fold. So make a note of this superior ileocecal fold related with the superior ileocecal recess. In that we have a vessel that is anterior cecal artery. Same way below this inferior ileocecal recess, related with that we have a fold of peritoneum, that is inferior ileocecal fold. Otherwise you are calling it as a bloodless fold of Treves. Then going into the interior part of this cecum, how it looks. So interiorly it's having, if you see basically the posteromedial part of the cecum, it's having two openings. This will be your ileum opening into the cecum, so ileocecal opening. So guarding that we have valves. One is superior and one is inferior valve. So superior valve is somewhat horizontal and inferior valve is somewhat concave. So this is your superior, other name for them is superior lip, and this is the inferior. So these will be extending laterally. These you are calling it as the frenulum. Frenulum are nothing but the projections from this ileocecal valve, superior ileocecal valve and inferior ileocecal valve. Laterally they are projecting, they are called the frenulum. Then 1 to 2 centimeters below this ileocecal opening we have one more opening of appendix. So this is your appendicular opening. So here it's having a valve called valve of Gerlach. So what is the function of this ileocecal valve? It will be preventing the regurgitation of the contents from the cecum into the ileum, and even it will be regulating the flow of the contents from the ileum into the cecum. Then what are the other things? We have this arterial supply, venous drainage. So arterial supply. So this cecum is a part of your midgut. So superior mesenteric artery will be giving a branch called ileocolic artery. From that we have a branch called, two branches. One is anterior cecal branch. One more thing is posterior cecal branch. So these are the anterior cecal artery and the posterior cecal artery. They will be giving the blood supply to this cecum. Then venous drainage, all this drain into superior mesenteric vein. Then lymphatics, they drain into ileocolic nodes, and that last nerve supply, you can divide that into parasympathetic nerve supply and sympathetic. So parasympathetic is from the vagus, sympathetic is from the superior mesenteric plexus. They get the fibers from T11 to L1. So arterial supply by anterior cecal artery and the posterior cecal artery. So anterior cecal artery is a part of your anterior cecal fold, superior cecal fold. Then venous drainage, they are draining into superior mesenteric vein. Lymphatics, lymphatic drainage is into the ileocolic nodes. So what is the applied aspect for this? So whenever you are going for appendicitis surgery, how to trace that appendix? This tinea coli will be merging onto the base of the appendix. Then apart from that, whenever there is obstruction in the large intestine, cecum is most dilated and there are chances of perforation of this cecum. So that is about cecum. So in this we have this features. It's in that we will be having where it is located and what are the dimensions of this. It's present in the right iliac fossa and it's above, it's continuing with the ascending colon, and on the medial side it's related with the ileum, or it's having opening of ileum and the appendix. Relations anteriorly, anterior abdominal wall, if it is distended or if it is relaxed, it will be having small intestinal loops. Posteriorly, it's related with the psoas major, iliacus muscle, and femoral nerve, genitofemoral nerve, lateral cutaneous nerve of the thigh. And about the races, it's having three races. One is behind the cecum, that you are calling it as the retrocecal races, and two races related with the ileum, that is superior ileocecal recess, inferior ileocecal recess. So related with the superior ileocecal recess, we are having a superior ileocecal fold. In that superior ileocecal fold, there is a vessel, that is anterior cecal artery, which is coming from your ileocolic artery. Inferior ileocecal recess, it's having a fold anteriorly, that is inferior ileocecal fold. So that doesn't have any blood, so that's why you are calling it as a bloodless fold of Treves. And interiorly you are having two openings, that is ileocecal opening, which will be having a ileocecal wall, which will be having lips, superior lip which is horizontal and inferior lip which is concave, and these will be projecting laterally, that you are calling it as a frenulum. And one more thing, just 1 to 2 centimeters below that ileocecal opening, we are having appendicular opening. Appendicular opening will be having a valve called valve of Gerlach. Thank you.